Hi everyone, Dr. Chiam here. We're going to do a little bit of a demonstration today just to show you guys how we approach fillers to the under eye area and how we use fillers to improve the under eye conditions such as the tear trough or sunken eyes. And this is also a demonstration to educate our patients that actually for fillers, less is more. We often hope to try to achieve as natural a result as possible for our patients, and we want to use as little volume as possible for our patient to achieve a very natural result. This also allows me to demonstrate to all of you the various techniques we use for filler injections so as to try to minimize the risks as well as the side effects of fillers to patients. So we have Sharon here who has kindly agreed to be our model for today. Sharon has a very classic tear trough deformity. Basically, this line on the mid face, this is what we call a tear trough deformity. It is something that's not uncommon in our population, and fillers are often a good way to treat the tear trough deformity. So how we approach the tear trough deformity is always to start with the mid face. Very often, patients with mid-face deficiency or patients with saggy cheeks also develop the tear trough deformity. So if we look at Sharon's side profile, you will notice that she has a rather flat mid-face. There is not enough frontal projection of her cheeks. So that is something that we probably need to correct with the fillers. From the front, she actually has good high cheekbones, so this is an area that's actually quite ideal. We won't need to inject any filler into that area. And from the side, she has actually lost a little bit of bony volume on the cheekbone. So this is something that we need to try to correct with the filler. Very often, when we start with the mid-face, we will already start to notice that the tear trough deformity has already improved if we just augment the mid-face and improve the support to the mid-face. Also, even without injecting directly into the tear trough deformity, if we improve the projection of the mid-face, we can already improve the appearance of the tear trough deformity by obliterating what we call the lid cheek junction. So this is the junction between the lower eyelid as well as the cheek. And when we do that, it actually gives a much better appearance to the tear trough deformity already, and it gives the overall freshening up effect. So we're going to start off with the mid-face injections, and for the mid-face injections, because we're injecting down to bone, I prefer to use a needle for this. Basically, the needle allows us to have very precise injections into a specific area. For the under eye area, for example, if we're going to do a large area, we would use a cannula, and the cannula is also safer in areas like the under eye area because it's more well supplied by blood vessels. So we've done the cleaning already, and we're going to start. Okay, so we're going to start off by lifting the skin, okay, and we're going to do a single injection. Usually at this point we will aspirate the syringe to make sure that there's no blood coming out into the syringe. We are quite safe. We're not in a blood vessel, and then we will proceed to inject a small amount of filler into this area. Slow and steady injection is the safest technique. We're done here, so we're going to stop injecting and remove, and you can see that it's actually a bloodless procedure if it's done properly. Okay, so the second point of injection, we're going to go one more point on the cheekbones again to give Sharon a little bit more support. Okay, back again, we're going to pull it back. Second point, all the way down to the bone. Okay, aspirate like we always do. Okay, and we continue to give a little bit of a small little bolus of the filler. So this is a hard filler, basically a hard, highly cross-linked filler will give better support and it's more long-lasting. We will then proceed to give her better projection on the front part of her cheeks. This gives her two things. One, it gives her a better projection and more attractive looking cheek profile. It also helps to obliterate the tear trough deformity, as well as improving the appearance of the lid-cheek junction, which is the junction between the lower eyelid and the cheek. Okay, so the second part, we're going to do the under eye area. For this area, because we want to spread the filler evenly on the under eye area, and also because the under eye area is very well supplied by blood vessels, we use a cannula to make sure that we have the lowest risk of accidentally injecting into a blood vessel. So here we go. We already made an entry point on the cheeks, okay, and then we are going to put the cannula in. So this should be a very painless procedure, and we basically slide the cannula underneath the skin, okay, being very mindful of where the tip of my cannula is, so you can actually see that. Okay, we have to go deep for the under eye area. This is so that we don't give her lumps on the under eye area. And I'm already starting to inject as I go along. So we want to obliterate the tear trough deformity. So we've just injected a very small amount under the eyes. Take a look at Sharon. Okay, you can actually see that the tear trough deformity, although still there, it's already shortened by more than half. Okay, and compared to the other side, you can actually see the improvements with regards to the lid-cheek junction, as well as the lift of the mid-face. Usually for the under eye, I tell my patients that less is more. The less volume we can inject, the more natural results we achieve. And in this case, in Sharon's case, over the next 2 weeks, as the filler or the hyaluronic acid absorbs a bit more water, you will see even better results compared to right now. But this is actually quite a significant and natural result already. And Sharon can probably go home and nobody will notice that she's had a lot of work done. And basically, we expect her to get compliments of such as, "Oh, you look fresh, you look very well rested," because the overall effect of an under eye filler or under eye treatment is actually to make the patient look less tired.